Every week, tune in, don't miss out on Zimwaves TV, where we talk and shout.
Welcome to the saga of Zimbabwe's health sector, a tragicomedy that rivals Shakespearean drama, with state hospitals as the crumbling castles and government officials as the out-of-touch royalty. Imagine a hospital so underfunded that even the rats have packed their bags and left for greener pastures. Yet our government seems to believe that what we really need is an investment in goats and a side of Zek scandals. It's as if they've mistaken their roles in public service for starring in a surrealist play where logic is optional and public health is just a subplot. Zimbabwe's health system, once the pride of the nation, now resembles a set from a post-apocalyptic movie. Patients have to bring their own supplies. Yes, you heard that right. Blankets, food, and even bandages. It's like being asked to bring your own cutlery to a restaurant. And let's not even talk about the doctors and nurses, who are paid so poorly that they'd need to save for months just to buy a pair of decent shoes. It's no wonder they're striking, though now even that could land them in jail faster than you can say unfair wages. Amidst this chaos, the government decided to buy $5 million worth of anaesthetic machines. Now let's break this down. For an entire country, that's about as effective as using a teacup to bail out the Titanic. And here's the pièce de résistance. Zimbabwe has only one properly functioning theater. So these machines are about as useful as a chocolate teapot. Too little, too late, my friends. It's like rushing to install airbags in a car that's already been totaled. The cholera outbreaks are another chapter in this tragic tale. 3 major outbreaks have hit the nation recently, a direct consequence of neglected sewer systems and a lack of water treatment chemicals. It's as if the government decided to play a game of how low can we go with public health. The result? Nearly 4,000 people dead and 88,000 infected. Meanwhile, the officials responsible for this debacle are probably enjoying the finest healthcare in China, Russia, or South Africa. It's a bit like the captain abandoning ship and taking the only lifeboat, leaving everyone else to fend off the sharks. Now, if you think that's bad, let's dive into the figures. The doctor-to-patient ratio in Zimbabwe is 1/12,000. That's right, 1 doctor for every 12,000 people. It's a miracle anyone gets seen at all. And the spending? A meager $20 per person per year on healthcare. It's like trying to feed a family on pocket change. No wonder the system is collapsing under its own weight. Patients often find themselves in hospitals that are more like haunted houses, empty, eerie, and devoid of hope. Maternal and neonatal care is a horror story in itself. With a maternal mortality rate of 614 per 100,000 and an under 5 mortality rate of 75 per 1,000, it's clear that the system is failing the most vulnerable. Pregnant women are left to navigate a healthcare landscape as treacherous as a minefield, and children are caught in the crossfire of neglect and mismanagement. And then there's the staff. Overworked, underpaid, and demoralized, healthcare professionals in Zimbabwe are heroes fighting a losing battle. Many have fled the country, seeking better opportunities elsewhere. Those who remain are left to contend with burnout and depression, serving in conditions that would make anyone question their career choices. It's a bit like being a chef in a restaurant with no ingredients. The passion is there, but the resources are not. In this theater of the absurd, the audience is left to watch in horror as the plot unfolds. Zimbabwe's health sector is in critical condition, and the prognosis is grim. While the government continues its farcical pursuits, the people are left to suffer the consequences. If ever there was a time for a deus ex machina to swoop in and save the day, it's now. But until then, the tragicomedy continues, with each act more disheartening than the last. So here we are in the midst of this epic drama, hoping for a plot twist that brings relief and sanity. Until then, we brace ourselves for the next act, knowing that in Zimbabwe, reality often outdoes fiction.